Welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on infant mortality and the importance of a healthy pregnancy. Infant mortality is the death of an infant before his or her first birthday. And according to the most recent data, the average infant mortality rate in Wisconsin is 4.8 per 1,000 white infants compared to 14.2 for African American infants. With that in mind, the maternal mortality rate in Wisconsin is 5 times higher for black women than for white women. Those numbers alone highlight the importance of providing expectant mothers with resources to help them lead a healthy pregnancy. My first guests represent organizations that are committed to removing barriers and improving health outcomes to promote quality of life and reduce disparities among racial and ethnic communities. Michele Grant, the Chief Operating Officer at Milwaukee Health Services, Inc., and Babette Honoré is the Director of Community Engagement for Molina Healthcare. Good morning, ladies.
Good morning.
Thank you both for being here. And preliminary City of Milwaukee Health Department figures going back to 2017, they indicate that 120 infants born in the City of Milwaukee died before their first birthday, and that's compared to 90 infant deaths in 2016 and 95 in 2015. So whenever we go over the number of 0, that's one too many, right?
Yes,
so,
it is.
First and foremost, let's talk about some of the main causes of infant mortality.
There's several causes of infant mortality. The highest number, about 55%, is prematurity. That's the main cause of infant mortality. All of the others are around in the teens, 10 to 15%, but that's the primary cause.
Okay, and Babette, I know you have a history of working with this subject matter, so
Yes.
what are some of the other things that would lead to infant mortality?
Yes, I know the one thing that we talk about quite a bit is safe sleeping. However, as Michele just indicated, it's really prematurity, but safe sleeping is right up there. The other one is birth defects.
Okay.
And children being born with abnormalities.
Yeah, and so there are also pregnancy complications, of course,
right.
and then accidents that happen, but two of the main ones, like you said, would be premature birth and sudden infant death syndrome.
Right.
So there are a lot of different things to be talked about when you have an expectant mother, especially a young expectant mother, because a lot of times people think if they feel good and everything's going accordingly, then they don't need to see the doctor that often. But really seeing a doctor, a prenatal doctor, is so necessary for so many reasons.
Definitely is. It's important to establish care with a primary care provider who knows your history and can follow you throughout the pregnancy. They can also assess you for any high-risk activities that you may currently be involved in, or if there's something within your family that you need to watch out for that may impact your pregnancy, such as high blood pressure, diabetes, things like that.
And Andrea, if I could just add to that, personally, I had that issue in my 2 pregnancies. And you're absolutely right. I thought everything was fine. Felt great, the whole 9 yards. But because I was going to see my OBGYN, they identified that I had preeclampsia, which is high blood pressure. And that was my first one, and I had to have a C-section with her.
Wow.
And then my second one, I had gestational diabetes, which is, you know, high sugar levels. And I had to have a C-section with her as well. But because I had care from my OBGYN throughout the whole pregnancy, they were able to determine those things and then be able to treat me accordingly.
Yeah, and it's so important because, you know, a lot of women who have no health issues before their pregnancy, sometimes they deal with the diabetes and the high blood pressure. And it's important to mention that Milwaukee Health Services has specific programs and services in place for every stage of a child's life, even before they're born.
Yes, we do. We have pediatrics, we have women's health. So we have midwives and nurse practitioners that care for the mom throughout her pregnancy. And then when the baby is born, we have pediatricians who can take over the baby's care and actually visit the babies in the hospital after they're born.
Wow, that's a lot of good stuff. So I have you both here today because there's something big coming up, and I hosted this last year. And when I say it was amazing, it was really amazing to see so many expectant moms, and there were even some new moms that were at this community baby shower that Milwaukee Health Services through last year, and then Molina Healthcare being a presenting sponsor. So if you would kind of tell everybody, since you've teamed up to do it once again this year, what we can expect and when this is all going to take place.
So it's on Saturday, May 11th, from 10 o'clock to 3 o'clock p.m. at the Martin Luther King Heritage Health Center, which is 2555 North MLK Drive. So Milwaukee Health Services always tries to implement healthcare education while having fun.
Yeah.
So we have this, what we call luau baby shower. So last year was really...
Luau lullaby.
Yeah, lullaby. So we had this Hawaiian theme. It was really so nice last year. The ladies got catered to. Last year we had the fire department serving them lunch at their tables.
Yes.
We had Black Health Coalition, My Father's House, and some other organizations present. And we really just wanted to treat them like queens while educating them on their pregnancy and childbirth.
And they actually went home with a lot of fun prizes, and lunch was served. So really it was a great day all the way around. And Molina, as I said, is a presenting sponsor. So talk about the importance of Molina being a part of this and making a difference.
Certainly. As we've talked about, the health of our infants and our moms are really key and critical for us. What we provided was reusable bags that were chocked with things for mom to have. So diapers, wet wipes, water bottles. We even had some things for the moms, like tea bags and teacups for them. So
for those calming moments.
Yes, because you know they need that. I remember those days. But we had that available for them, and every mom that came in got that. And you should have seen. Well, you were there.
I was there. I did.
You
witnessed
saw
it.
the moms. Yeah.
It was a lot of fun too.
And so we have obviously in our membership women that are pregnant, and a fair number that go to Milwaukee Health Services Inc. And so we want to make sure that our partnership is strong, that we are providing those screenings, those healthcare screenings that are so vital and important, so the moms could take part of that. And as Michele talked about, providing that on the day of is just invaluable. They can go one place for everything. They can get a great meal, they can have great entertainment, they can learn a lot, and they can get those health screenings. So that's wonderful.
So just like last year, comedian Kelly Gill's going to be in the house, and she always has hilarious stories about being a mother. And there's DJ Cheerio and Jackie Caldwell singing to the ladies. Like you said, it doesn't get much better than that. And so what I want to do is just make sure everyone understands this is a free community baby shower. So what you want people to do, though, is call to RSVP so you'll know the number of people that you're serving, and you're looking for how many women to attend?
Well, last year we had 350 people. We had 150 moms. And so this year we've upped it because we want to make sure we spread the love and the wealth and the understanding. And so we're looking for 200 moms this year and over 400 people.
Okay, so this is a great time to mark your calendar right now, and I'll put the information on the screen. The community baby shower is again taking place on Saturday, May 11th from 10 to 3 p.m. at the MLK Heritage Health Center. That's at 2555 North Dr. MLK Drive. There will be screenings for dental, mammograms, cervical cancer, lead testing, immunization, glucose testing, blood pressure, STIs, pregnancy testing, the list goes on and on, you name it. RSVP by giving Pamela Clark a call at 414-267-2655. And Babette, if you would, give us a little bit of the history behind Molina Healthcare, because there really is a special story that really gives people an opportunity to understand why you are so concerned with individuals who may be underserved in a community, and really why it's important for you to do things like the community shower.
Yeah, thank you for asking. We were started from Dr. Molina in Long Beach, California. He was an ER doctor, emergency room doctor, and he noticed that people were coming in that had ear infections, things that you could take care of with your primary care physician. And he said, oh no, there's something that's a disconnect here. It's something not right with individuals that feel like they got to come to the ER, and still we have that issue. But he said, I've got to do something about this. And so he started low-income clinics so that individuals could get seen. And that blossomed into who Molina Healthcare is today. And we're in 14 states. Here in the state of Wisconsin, we have over 60,000 members.
Wow.
And I'm happy to say that Milwaukee Health Services, Inc. is a major provider for us in our network. But our mission is to make sure that individuals that are of low income do get good quality care.
That's what it's all about, and that goes all the way back to, I think, 1980.
Yes.
So really a testament of how long these services have been provided to individuals who are in need in many ways. So Michele, before we run out of time in this segment, you did mention that there's a long list of services that focus on women and babies at Milwaukee Health Services, Inc. You've got your WIC program, which I think is really important when it comes to women being able to provide supplemental things like formula and oatmeal and things like that to their kids.
Right, and nutritional services and education, because moms need nutrition while they're pregnant. So, you know, you can sign up for WIC while you're pregnant, and so they can help you with your nutritional needs, and then after the baby is born, help you by supplementing the formula and other foods that the baby would need. And so they work hand in hand with our pediatrics department and our women's health department.
Okay, and you also mentioned your free home visitation program called Caring Hands, and there's the pediatric services, the women's health clinic, outreach, and enrollment. So with all those things mentioned, that's just the tip of the iceberg. We invite people to go to your website to see everything that Milwaukee Health Services, Inc. Offers to individuals, even outside of, you know, being a woman. You've got a million other things under one roof. And finally, Milwaukee Health Services, Inc. is also part of the Milwaukee African American Perinatal Health Collaborative, and that includes Milwaukee Health Services President and CEO, Dr. Tito Izzard, Dr. Patricia McManus from the Black Health Coalition of Wisconsin, My Father's House, and the African American Breastfeeding Network, Inc. Talk about what the overall goal of all of these organizations coming together to make a difference. What's your ultimate goal?
The goal of the collaborative is to empower grassroots organizations. All of the members of the collaborative already have an established face and a trust in the zip codes with the highest infant mortality rates. So the goal of the collaborative is to find funding and assist organizations that already operate within those high rate zip codes and to expand upon them. A lot of grassroots organizations don't have funding. A lot of people do it voluntarily. You know, they volunteer their time, they volunteer their resources. Sometimes you may see them, you know, requesting things that they need for their community. It could be like a food pantry. There's organizations that do food pantries on a weekly basis, but they don't have any support. So it was our goal to locate and empower these individuals who already perform the services, you know, in the high rate, highest infant mortality zip code.
Yeah, it takes a village, and that's exactly what it boils down to. And you mentioned some of the zip codes with the highest infant mortality rates. What are a few of those?
06, 09, 12, 18, 12. I said 12 already, right?
That's okay.
10. Yeah, but those areas are Milwaukee Health Services focused, target service area.
Yeah.
And so the organizations that I mentioned, it just happened to be the same zip codes because that's where the need is, that's where the problem is. And so our goal is to let people make their own decisions. Let the community tell us what they need, what they want. Let them be a part of the decision-making process. As you may know, FQHCs are patient-driven because their board members are patients. A lot of people don't know that. So we don't want to just walk in somewhere and say, hey, this is what you need. We wanted to empower people to tell us what they need, and then we can assist within our skill set.
Okay.
And so that's what the goal is.
That's what it's all about. Thank you so much
You're
for coming
welcome.
by and filling us in on all the great things that's happening, and we're looking forward to the big baby shower coming up soon.
Thank you.
Michele Grant is the Chief Operating Officer at Milwaukee Health Services, Inc., and Babette Honoré is the Director of Community Engagement for Molina Healthcare. Keep in mind, Milwaukee Health Services, Inc.'s Community Baby Shower that will also offer health screenings, education, and resources is sponsored by Molina Healthcare, and it's happening Saturday, May 11th from 10 till 3 p.m. It's free and open to the public, and for more information and to RSVP, you can call Pamela Clark at 414-267-2655. When we return to Our Issues Milwaukee, we'll continue our conversation about healthy babies, discussing the importance of breastfeeding and a whole lot more. We'll do that right after this.